1. Which of the following administrative thinkers defined administration as the organization and direction of human and material resources to achieve desired ends? A. L. D. White. B. J. M. Fifner. C. J. A. Vague. D. H. A. Simon. 2. Which one of the following statements is not correct in respect of new public management? A. It has market orientation. B. It upholds public interest. C. It advocates managerial autonomy. D. It focuses on performance appraisal. 3. Which of the following is not the duty of a district magistrate? A. Maintenance of law and order. B. Supervision of elections. C. Collection of revenue. D. Conducting judicial trials. 4. Under which article of the Constitution of India did the District Planning Committee come into existence? A. 243 ZD. B. 243 ZE. C. 244 ZD. D. 242 ZD. 5. Which one of the following states does not have Panchayati Raj institution at all? A. Assam. B. Tripura. C. Kerala. D. Nagaland. 6. Which of the following is not correct about civil society organizations? A. They are sovereign bodies. B. They are voluntary but non-profit-making agencies. C. They work in close proximity with people. D. They create awareness, educate and sensitize people on common issues and act as catalysts of social change. 7. Which of the following administrative thinkers has defined administration as the organization and direction of human and material resources to achieve desired ends? A. L. D. White. B. J. M. Fifner. C. J. A. Vague. D. H. A. Simon. 8. Which one of the following statements is not correct in respect of new public management? A. It has market orientation. B. It upholds public interest. C. It advocates managerial autonomy. D. It focuses on performance appraisal. 9. Which of the following is not the duty of a district magistrate? A. Maintenance of law and order. B. Supervision of elections. C. Collection of revenue. D. Conducting judicial trials. 10. Under which article of the Constitution of India did the District Planning Committee come into existence? A. 243 ZD. B. 243 ZE. C. 244 ZD. D. 242 ZD. 11. A 65-year-old male presents with sudden onset chest pain radiating to the left arm. Which of the following is the most appropriate initial diagnostic test? A. Chest X-ray. B. Electrocardiogram ECG. C. Echocardiogram. D. Cardiac enzyme assay. 12. Which of the following antibiotics is most appropriate for treating community-acquired pneumonia in an otherwise healthy adult? A. Amoxicillin. B. Ciprofloxacin. C. Doxycycline. D. Vancomycin. 13. A patient with a history of atrial fibrillation is at increased risk for which of the following complications? A. Myocardial infarction. B. Stroke. C. Pulmonary embolism. D. Deep vein thrombosis. 14. Which of the following is a common side effect of ACE inhibitors? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. 15. In the management of type 2 diabetes mellitus, which of the following medications is considered first-line therapy? A. Insulin. B. Metformin. C. Sulfonylureas. D. Thiazolidinediones. 16. A 30-year-old female presents with a butterfly-shaped rash on her face. Which of the following is the most likely diagnosis? A. Rosacea. B. Systemic lupus erythematosus. C. Seborrheic dermatitis. D. Psoriasis. 17. Which of the following vaccines is contraindicated in pregnancy? A. Influenza inactivated. B. Tetanus, diphtheria, cellular pertussis, staph. C. Measles, mumps, and rubella MMR. D. Hepatitis B. 18. A positive McMurray test is indicative of injury to which of the following structures? A. Anterior cruciate ligament. B. Medial meniscus. C. Lateral collateral ligament. D. Posterior cruciate ligament. 19. Which of the following is the most appropriate initial treatment for anaphylaxis? A. Antihistamines. B. Corticosteroids. C. Epinephrine. D. Albuterol. 20. Which of the following laboratory findings is most consistent with iron deficiency anemia? A. Elevated ferritin. B. Elevated total iron binding capacity TIBC. C. Elevated serum iron. D. Elevated transferrin saturation. 21. In health policy analysis, what is the primary purpose of a cost-benefit analysis? A. To evaluate patient satisfaction. B. To compare ethical considerations. C. To determine the net economic value of interventions. D. To calculate reimbursement rates. 22. Which federal program is primarily responsible for providing health coverage to low-income individuals and families in the U.S.? A. Medicare. B. CHIP. C. Medicaid. D. TRICARE. 23. A physician assistant in a public health clinic notices a recurring cluster of foodborne illness. What is the appropriate first step? A. Notify the CDC directly. B. Refer patients to urgent care. C. Alert the local public health department. D. Prescribe antibiotics for all affected. 24. Which legislation significantly expanded healthcare access in the U.S. and introduced value-based care models? A. Social Security Act. B. HIPAA. C. Affordable Care Act ACA. D. Emergency Medical Treatment and Labor Act EMTLA. 25. In a rural health setting, an MPA-PA graduate is developing a telemedicine program. What is the most critical first step in the planning process? A. Train clinical staff on software use. B. Purchase telehealth equipment. C. Conduct a needs assessment of the patient population. D. Apply for federal grants. Public Administration Physician Assistant. The Master of Public Administration Physician Assistant MPA-PA test is a specialized examination that evaluates a candidate's knowledge in both clinical medicine and public administration. Designed for healthcare professionals pursuing leadership roles, it assesses competencies in patient care, diagnostics, health policy, ethics, healthcare management, and systems-based practice. The test ensures that physician assistants with public administration training are equipped to make informed decisions that balance individual patient needs with community health strategies and policy development. Successfully passing the MPA-PA exam demonstrates readiness to lead in complex healthcare environments, bridging the gap between clinical expertise and administrative governance. Here are the top 5 beneficial uses of the sample exam. 1. Dual career advancement. The MPA-PA test prepares professionals for leadership roles that combine clinical practice with healthcare administration, broadening career opportunities across hospitals, public health agencies, and policy organizations. 2. Policy influence. It equips PAs with the skills to evaluate, implement, and influence healthcare policy, making them valuable contributors to systemic improvements and community health initiatives. 3. Efficient healthcare management. Certification validates the ability to manage clinical services while optimizing resource allocation and administrative operations, enhancing healthcare delivery outcomes. 4. Improved patient advocacy. Professionals can bridge the gap between frontline care and administrative decision-making, advocating effectively for patient-centered reforms. 5. Interdisciplinary collaboration. It fosters stronger collaboration across medical, administrative, and governmental teams, improving health system coordination and responsiveness.